which is to study the biomarkers in central serous chorioretinopathy on OCT angiography and its correlation with the clinical course of disease. Central serous chorioretinopathy is a common chorioretinal disease which is characterized by the serous detachment of the neurosensory retina from the retinal pigment epithelium. It's the most common cause of the central vision loss with the incidence of 1 is to 10,000. Several risk factors have been identified such as high corticoid levels, type A personality, uncontrolled systemic hypertension, etc. OCT angiography is a new non-invasive non-dye depth resolve technique which may be used to investigate patients with CSCR. The concept of OCT angiography is detection of the changes in blood flow in the vessels in a static eye without need for dye injection. By calculating the decorrelation of the signal amplitude from the repeated consecutive B scans at the same cross section, a contrast between the static and the non-static tissue is created and generates a vascular decorrelation signal that enables visualizing 3D retinal and the choroidal vasculature. Our aim in this study was to identify the predictive biomarkers in patients affected by CSCR on OCT angiography and its correlation with the clinical course of disease. It was a prospective hospital study from September 2021 to September 2022. Inclusion criteria were age greater than 18 years, patients with clinical history of acute CSCR with presence of SRF involving the fovea on structural OCT. Exclusion criteria were presence of any other retinal disorder potentially confounding the clinical assessment, any previous treatment on CSCR, and presence of significant media opacities. Patient underwent a complete ophthalmic examination and a standardized imaging protocol which included fluorescein angiography and structural domain OCT. All patients underwent OCT angiography, acquired OCT angiography volume 3:3 mm. Fisher exact test and the student pair t-test was performed to test the interdependence between the biomarkers and analyzed, and p-value less than 0.05 was considered as statistically significant. A total of 26 eyes of 25 patients, 2 females and 23 males who met the inclusion criteria were included in this study. Mean CSCR duration at baseline was 10 weeks plus minus 4 weeks. OCT angiography showed at outer retina level there is detected the presence of abnormal blood flow. OCT angiography showed 3 main anomalies at the choriocapillaries level, that is the presence of dark area which were frequently associated with the serous retinal detachment, presence of dark spot which were frequently associated with the retinal pigment epithelial detachment, and the presence of abnormal choroidal vessels. After a treatment of 10 weeks plus minus 4 weeks, mean central macular thickness significantly reduced and mean BCVA improved. The age distribution was maximum between the age of 31 to 40 years. Male ratio is predominant, and the visual acuity at first visit was between, a majority was between the 6/18 to 6/24, and CMT was between 301 to 400 microns. The mean logMAR was improved from 0.6 to 0.2, and the last visit CMT was between maximum in 201 to 300 microns. Automatic segmented choriocapillaries and the outer retina OCT features in CSCR patients were dark area was found in 22 patients, dark spot was found in 5 patients. There was irregular flat and hyperreflective deposit were also seen, and abnormal vessels were seen in 12 patients. This is the fundus photo of the 32-year-old male showing the shallow detachment at the macular level. Same patient, fluorescein angiography showing the blood appearance, and the OCT of the same patient showing the shallow detachment with the pigment epithelial detachment. On the OCT angiography, on the outer retina level, there was abnormal dilatation of the vessels, and dark area and the dark spot were seen at the level of choriocapillaries. This is the same patient at the 3rd month. The dark area was resolved by the end of 3rd month, but dark spot was still present due to the pigment epithelial detachment. And the discussion of my study was, in our study, the dark area corresponding to the diffuse or the focal, foggy, ill-defined, low-detectable flow areas in the choriocapillaries layer. The dark spot corresponding to the black, single or multiple well-delineated areas where no flow was detectable at the choriocapillaries. Conclusion was, it showed dark areas and dark spots as common findings observed at the choriocapillaries in eyes with CSCR. It also revealed the presence of abnormal dilated choroidal vessels at the same level, persistence of biomarker during the clinical course of disease, and even after the resolution of the SRF improves our understanding towards the disease pathophysiology. Thank you.
Thank you. Any questions?
Is CSR a vascular disease?
Ma'am, choroidal vascular disease.
Is it a choroidal vascular disease?
Yeah,
Pachychoroid,
Yeah.
pachychoroid. But the dark area that you are describing is the shadowing effect of the fluid on the vasculature and the distortion, as well as the dark spot. These are both actually artifacts in octa.
Maybe,
and that's just because you had fluid and the fluid resolved. They are not really
yeah,
findings or features.
In actually, when we see through SWEFT, so enhanced depth OCT angiography, we can actually detect the low detectable areas which are not by the due to overlapping by the shallow detachment or by the fluid. There is actually presence of dark areas which showed the low detectable areas on those choriocapillaries.